Welcome to our training session on emergency procedures training. Course objectives: to equip office and field staff with the necessary knowledge, skills, and confidence to effectively respond to emergencies, ensure workplace safety, and maintain patient care continuity during disasters. Introduction to emergency preparedness. Emergencies can happen unexpectedly and disrupt patient care, workplace safety, and operational continuity. This training will prepare you to handle crises such as natural disasters, technological failures, and public health emergencies with professionalism and efficiency. Why emergency preparedness matters: protecting patients, staff, and facilities during disasters, ensuring compliance with emergency response regulations, minimizing disruption to essential healthcare services. Examples of emergencies: natural disasters, floods, hurricanes, tornadoes, snowstorms; technological failures, power outages, disruptions; man-made events, hazardous material spills, fires and terrorism; public health crises, pandemics or infectious disease outbreaks. Key takeaway: effective preparedness reduces chaos, saves lives, and maintains healthcare operations during emergencies. Workplace health and safety. A. Hazard identification. 1. Fire safety. Locate fire extinguishers, alarm pull stations, and emergency exits in your facility. Fire extinguisher use: pass method, pull the pin. Aim at the base of the fire. Squeeze the handle. Sweep side to side. Scenario: a fire starts in the break room. You activate the nearest fire alarm. Evacuate patients and staff immediately. Use a fire extinguisher if it is safe to do so. 2. Chemical spill management. Immediate steps: evacuate the area and restrict access. Notify your supervisor. Only trained staff should use spill kits to contain the chemical absorbent materials. Gloves, goggles. Scenario: cleaning supplies spill near patient rooms. You block off the area. Ensure all patients and staff are relocated to safety. Contact maintenance or trained personnel for cleanup. 3. Infectious disease protocols. Always wear appropriate PPE, gloves, masks, gowns, and eye protection. Follow hand hygiene protocols before and after patient interaction. Follow respiratory hygiene etiquette when handling suspected infectious cases. 4. Workplace ergonomics during emergencies. Prevent injuries when assisting patients by using proper lifting techniques and equipment. Avoid repetitive strain injuries when preparing for evacuations. Workplace safety essentials. Clear evacuation routes. Ensure hallways and emergency exits are unobstructed. First aid stations. Know the location of first aid kits and emergency supplies. Backup power. Be familiar with generator operation for critical systems. Equipment inspections. Regularly inspect medical devices and backup equipment for readiness. Activity. Conduct a walkthrough of your facility to identify fire exits, evacuation routes, safety equipment, and generator locations. Record potential obstacles or risks. Emergency kits. A. Importance of emergency kits. Emergency kits ensure that staff and patients have the supplies they need to survive for at least 72 hours during a disaster. Key takeaway: a well-prepared kit is a foundation for survival during disruptions. B. Personal kits contents: tools and supplies, flashlight, extra batteries, multi-tool, whistle, waterproof matches. First aid supplies: gloves, bandages, antiseptic wipes, CPR mask, thermometer. Food and water: 3-day supply, protein bars, 3 liters of water. Documents: ID badge, emergency contact list, facility maps, evacuation plans. Comfort items: thermal blanket, personal medications, sunscreen, and insect repellent. Demonstration. Display a fully packed emergency kit and explain the purpose of each item. Discuss scenarios where specific items might be critical. See patient emergency kit's contents. Medical supplies. 7-day supply of medications, clearly labeled, portable oxygen, nebulizers, glucose monitoring kits, or any other specific patient needs. Documents. Copies of medical records, care plans, ID cards, and allergy lists. Comfort items. Blanket, hygiene products, toothbrush, wipes, personal effects like glasses or dentures. Food and water. Ensure sufficient supplies tailored to dietary restrictions, egg, low sodium, liquid nutrition. Activity. Participant family will assemble a sample emergency kit for a patient with specific needs, A, diabetic or oxygen dependent. Inspection frequency. All emergency kits must be inspected and replenished every 6 months. Emergency procedures. A. Evacuation protocols. 1. Assess the threat. Determine the urgency. Is the danger immediate, egg, fire, or progressive, egg, rising floodwaters? Prioritize patients. Level 1, critical. Patients requiring ventilators, continuous care, or advanced life support equipment. Level 2, moderate. Patients needing assistance due to limited mobility or dependence on regular medications. Level 3, low priority. Patients who are self-sufficient and can follow instructions independently. 3. Transport safely. Use ambulances for high-priority patients. Assign staff to accompany patients with special needs. Ensure transportation includes essential patient supplies, egg, oxygen. Medications. 4. Document and track. Record patient conditions, assign transport and destinations, provide copies of medical records to the receiving facility. Activity. Conduct a role-play evacuation where staff must prioritize patients, assign transportation, pack necessary supplies, and ensure clear documentation. B. Shelter-in-place protocols. 1. Secure the area, lock doors and windows. Shut off HVAC systems if hazardous air is present. Use duct tape and plastic sheeting to seal doors and vents if directed by authorities. 2. Provide resources. Distribute water, medications, and food from emergency kits. Assess and ration resources if needed. 3. Monitor patients. Assign staff to regularly check on patient conditions and administer medications. Establish a rotation to prevent fatigue. 4. Communication protocols. Maintain constant updates with local emergency services and communicate status to patient families. Scenario: a chemical spill occurs nearby. Staff practice sealing a room. Distributing emergency supplies and logging patient conditions. Communication protocols. A. Internal communication. Follow the facility communication tree. 1. Notify the incident commander. 2. Alert team leads. 3. Communicate with field staff and families. Use backup systems such as radios or satellite phones if cell service is disrupted. B. External communication emergency contacts, fire and EMS. Call 911 for life-threatening situations. Activity. Role-play a communication failure scenario where staff must relay critical information using backup methods. Practice drafting a concise emergency status update for external agencies. Real-world scenarios and drills. Scenario 1. Power outage during a snowstorm situation. The facility loses power. 2 patients rely on ventilators. Roads are blocked. Your response: activate backup generators. Monitor patients' vital signs and ensure ventilators remain operational. Contact local authorities for assistance. Trainer feedback. Evaluate decision-making and recommend improvements. Discuss alternate solutions if backup generators fail. Scenario 2. Flood evacuation situation. Flood waters are rising. You have 30 minutes to evacuate. Your response: prioritize patients by level of need. 1. Group and assign patients for transport. Level 1. Critical patients. These patients are transported first using ambulances or other critical care-capable vehicles. Ensure all life support equipment, ventilators, oxygen tanks, is secured and operational. Level 2. Moderate patients. Assign wheelchair-accessible vans or staff-assisted transportation to patients needing mobility support. Level 3. Low-priority patients. Load ambulatory patients onto buses or general transport vehicles. 2. Prepare transportation resources. Contact pre-arranged transportation providers. Confirm the availability of backup services in case of delays or increased patient needs. Check all vehicles for adequate fuel, emergency supplies, and clear instructions for drivers regarding patient destinations. 3. Pack emergency supplies for transport. Each vehicle must carry first aid kits, patient-specific medical kits, medications, portable oxygen, assistive devices, water, snacks, and thermal blankets for patients and staff. 4. Communicate with receiving facilities. Notify the receiving facilities of the number of patients, their conditions, and expected arrival times. Share patient records securely to ensure continuity of care upon arrival. 5. Conduct final checks before departure. Verify that all patients have been accounted for. Perform a final head count. Ensure staff have been assigned to accompany patients and oversee their care during transport. Post-evacuation actions. 1. Reassess patient needs upon arrival. Check vital signs and general well-being for all patients. Administer medications and set up medical devices immediately for critical patients. 2. Communicate with families. Notify patient families of their loved one's location, condition, and any follow-up steps. 3. Debrief staff. Review the evacuation process. Discuss challenges faced and identify areas for improvement. Activity. Conduct a mock flood evacuation drill where staff practice prioritizing patients, preparing transport, and executing communication protocols. Scenario 3. Tornado warning situation. A tornado warning has been issued for your area. Patients and staff must shelter in place immediately. Your response. Move patients to designated safe zones. Identify interior rooms without windows or basements as tornado-safe zones. Relocate patients with critical needs first, ensuring that all necessary medical devices and supplies are brought with them. 2. Secure the facility. Close all windows and doors. Shut off gas lines and power if instructed by emergency authorities. 3. Distribute emergency supplies. Provide water, snacks, and medications as needed. Ensure each patient has access to thermal blankets or other comfort items. 4. Monitor emergency updates. Use a battery-powered radio or other reliable means to stay informed of tornado updates. 5. Calm and reassure patients. Provide clear, consistent communication to reduce panic. Engage patients with calming activities, simple conversations or games. Post-tornado response. Inspect the facility. Assess structural damage and determine whether it's safe to continue operations. Relocate patients to alternative facilities if necessary. Document and report. Record any injuries, damages, or resource shortages. Submit reports to local emergency management authorities and the incident commander. Activity. Simulate a tornado shelter-in-place scenario where staff practice moving patients to safe zones and maintaining communication under pressure. The Red Book Emergency Relocation Plan. The following actions are to be taken to prepare for the potential need to relocate participants during an emergency event. An emergency relocation plan is to be maintained in the Red Book. Easily accessible to staff. The Red Book is designed for quick access during emergencies, and it contains essential participant information and emergency procedures. These papers are printed out and staff receive in-service training on them. In the event there's an emergency, staff will always grab this book along with the participant's medication. This book will be in red. It will have all the participants' emergency individual fact sheet and include all relevant medical and personal information for each participant. Fire drill form and schedule. The red book will also include a form with a monthly fire drill schedule that will specify the appropriate shift for each drill. It will be ensured that a fire drill is conducted each month by staff. Relocation form provides instructions on where to go in the event of an emergency. This ensures staff are prepared and the safety of all participants is prioritized during emergencies. Thank you for watching Emergency Procedures Training. Please answer the questions for this training before moving on to the next training module.